Welcome to Science Saturday, a new forum that highlights the important partnership between researchers and patients with complex lymphatic anomalies and their families. Science Saturday is sponsored by LGDA in collaboration with the Lymphatic Malformation Institute. My name is Mike Kelly, and I'm now the Executive Director for LGDA and your host for today's session. Dr. Kimberley Steele, the LGDA Director of Patient-Led Research, is also joining us this evening. The goal of Science Saturday is to highlight the impact of research on the care of our patients. This forum brings together patients, their families, and scientists, highlighting how research impacts the patient journey and how patient experiences help shape research. Today, we will discuss Taylor's journey, a young lady diagnosed with generalized lymphatic anomaly. Taylor will describe her diagnostic odyssey and share how her journey was impacted by exciting research performed by Dr. Adrienne Hammill and her colleagues at the Children's Hospital of Cincinnati, University of Cincinnati College of Medicine. The title of today's presentation is Successful Treatment of Generalized Lymphatic Anomaly with the PI3 kinase inhibitor Alpelisib. Taylor, welcome to Science Saturday, and I want to thank you in advance for sharing your story. Please tell us more about you and how you were diagnosed with GLA.
Yeah, so thank you for allowing me to do this today. It really means a lot for me to be able to reflect on this. With my diagnostic odyssey, it kind of began, I had some of what are more of the typical symptoms that are coming up, but were certainly brushed off. I had chronic bouts of pneumonia, probably had it 8 to 10 times as a kid, had pretty bad growing pains growing up. I remember that just being something that was highlighted, but I was also a competitive tennis player, which I think was one of the main reasons I had such a hard time being diagnosed, because a lot of the doctors were brushing it off as me just being too hard on my body, and that's why I was having bone problems. So I went to numerous physical therapists, a back surgeon when I was 16 that wanted to do a surgery on me because he thought all the lesions in my spine were herniated discs and that he was going to essentially fuse my spine at that time. Along with that, I was kind of bouncing around. I was having some GI issues, and I went to a gastroenterologist for that. And, after visiting my pediatrician, visiting all these doctors, we were feeling very helpless. It got to the point of the GI doctor telling me that, it was all in my head and that I needed to seek psychiatry due to, she was thinking that, maybe I just didn't want to go to school. And so I would stay home sick with my stomach problems. But in fact, I love school. I had a great, upbringing. I was very involved with athletics, but just nothing was clicking. I couldn't surpass like a normal tennis practice without passing out or just being in so much pain that I would go home and feel it for the next week. So by that time, I had one day at practice in particular. I think at this time I was 16 or 17, and we were doing this drill and I just passed out because I was in so much pain. And we went to the ER, and the doctor was just like, oh, it's probably like an ovarian cyst, like follow up with your doctor and come another time. And thank goodness my mother advocated for me at that time, because she was very insistent. She's like, she doesn't complain for just anything. Like, I know she's in pain. Please just try and give her a scan of some sort. And I just remember the push and pull was so difficult to get people just to listen to us. And so once I got that scan at the emergency room, they first thought like it lit up like a Christmas tree. And they thought that I originally had lymphoma. That's what Stanford was thinking when I went there from the ER. They were pretty convinced. And then after meeting numerous doctors there, I met somebody very important to me, Dr. Michael Jang. I could get emotional talking about him just because how much he changed my life and connected me to Dr. Hammill here. He was the doctor that took an interest in my case and just completely listened for the first time ever. And even when there were other doctors in the room trying to pull me away because everybody seemed so fascinated with what was going on internally, he was the most comforting in knowing just how to treat me. So I'm forever grateful for that. Do you want me to begin going into some of the therapies at that time?
Yeah. So, just tell us a little bit about, how you and the doctors chose a treatment, and how did you respond?
Yeah, so I'm very thankful for my parents, and this is something that I think is important to get across to other parents as well, is please allow your child to be part of the decision-making process. As a 17-year-old girl, when I was at Stanford, there was a cardiologist that was wanting to put me on interferon. At this time, all I could think was, okay, like I still had it in my head that I was going to go for tennis. And I was thinking, I'm going to be bald. That was that was a lot for, a 17-year-old girl who's starting in college to kind of process, especially one that doesn't quite understand the severity of what's going on with health. And at that time, it was really interferon or this clinical trial in Cincinnati. And that's what ultimately brought me to Cincinnati at the time, because of the hope of the way the research was described to me, especially by Dr. Jang, feeling it was going to be very promising and something to really give a go at.
And that's great. And tell us, how are you doing now?
Now I can say I'm I'm feeling great today. I really it's been a 180. About 6 months ago, I had just a horrible episode. I contracted COVID in November. I was on the sirolimus at that time, also receiving Zometa infusions, which have been very helpful for the pain. But at that time, it just completely kind of flipped my treatment upside down. It felt like I wasn't on anything anymore, and that my disease had just progressed. And I was feeling at that time, I know, just helpless of where to go. But now, since I've started Alpelisib, I've felt amazing. I've had minimal side effects and all but good things to say, really.
That's fantastic, Taylor. I'm glad to hear that you're doing much better. Dr. Hammill, can you kind of give us an idea of how you made the diagnosis of GLA, and how you sort of decided, or with Taylor, how you decided to treat with Alpelisib?
Okay, so those are different steps, but the original diagnosis was actually made by Dr. Jang in collaboration with us. They had already sent tissue for preview. They had tried several bone biopsies of some of her lesions, and they were difficult to stain, but one rib lesion in particular looked like lymphatic spaces and helped us make the diagnosis, along with all of the imaging that showed these innumerable bone lesions throughout her spine, pelvis. I think there are a couple of others. I think I wrote it down. Iliac, yeah. So pelvis, ribs, and spine in particular, and then lesions throughout her spleen that were very classic for GLA. So we did confirm that diagnosis based on the imaging and the pathology that she already had, and that's what made her eligible, along with for the clinical trial at that time. She had to have complicated disease, so we had to confirm the GLA, and we had to confirm, or although at the time we called it a microcystic lymphatic, we had to confirm the disease, and then we had to say that it was complicated, and she had this chronic pain, bony pain. She had chronic diarrhea, GI symptoms. I don't know. Taylor, let me know if there's anything I'm not supposed to say.
No, you're welcome, honestly, to say anything. That was one of the biggest things, and I didn't mention that as well. It was confusing to diagnose me, I think, prior to obviously getting the experienced doctors in this field, because I was having these GI symptoms and then I was having these back problems, but like no part of me thought that they were connected. I was having, when I was not on sirolimus, and 6 months ago, the diarrhea was 15 to 20 times a day. It was debilitating. I wasn't functioning. Now on Alpelisib, it is 1 to 2 times a day. And I mean, just like complete turnaround.
So her constellation of symptoms, the imaging, the pathology, is what led her to be eligible for the sirolimus trial that we were working on here from 2009 to 2014. I think you came right after your 18th birthday in 2012. And there had been a lot of discussion already about the consent, about deciding to do this. And we spent a lot of time making sure they wanted to do it, knowing that it was going to mean a lot of travel back and forth from California to Cincinnati. And we got her imaged and got her first dose all while she was here with that first visit. And she had improvement in symptoms over that year. One of the things about Taylor being really active, like she said, she was a competitive tennis player. She actually required the highest levels the highest doses I've ever given anyone. On study, I think you were on 4 milligrams twice a day, 8 milligrams a day. And after the study ended, she chose to continue sirolimus. And even then, when we relaxed the levels a little bit, she would get symptoms crop up whenever we tried to go down very much. So for several years, basically until 2020, she was on sirolimus and with levels mostly 8 to 10. When, I guess you can talk about when your back pain got worse shortly before your wedding, that's when we introduced the Zometa.
Mm-hmm. Yeah, so for the most part, sirolimus throughout college kept me stable. Other than some of the side effects, I wrote a few down just to kind of keep reference, but it's having a lot of nausea, headaches, like cystic acne, just kind of like difficulty in general staying well, especially in a college environment that was really challenging. But for the most part, I was doing okay. But it was creeping up, like the back pain was consistently, slowly crawling until recently when things changed. But for the most part, it kept me okay until starting Zometa, which I think was a really good decision because of just like, I can feel the difference in the stability of my spine after I have it. It's such an interesting sensation going in versus a week later when I've recovered from it. It's quite incredible.
And Dr. Hammill, would you like to explain to our audience a little bit about how bisphosphonates or Zometa works?
So yeah, zoledronic acid is one of the bisphosphonates, and it's used usually for osteoporosis. Also, in particular, zoledronic acid or Zometa is used in breast cancer for people who have bony metastases. Because it prevents or basically lays down bone that is difficult for the cells to break back down, osteoclast cells to break back down. So it's creating bone that's resistant to breakdown, and that has made a difference. That combination of sirolimus and zoledronic acid together has been used quite a bit. The Zometa or zoledronic acid in particular may be a little bit different than some of the others because it has this theoretical effect on RAS. And so it may have some synergy with sirolimus. And that's the one that we've used most frequently for this purpose.
Okay. And
Taylor,
thank you. That was very helpful. Go ahead. I didn't mean to.
I was going to Taylor in particular had more side effects than most people have. A lot of people can have significant fevers, chills, and such for a day or so, particularly around the first dose. She had a much harder time with it. You want to talk about that?
Yeah, so with the first couple infusions I was having odd side effects of like chest tightness. I was waking up with difficulty breathing. I ended up going to the emergency room for it. I was having a lot of swelling in my limbs and very, very intense pain in my spine. That happened for the first few. Thankfully, this last one I got, which was the same dosage, I handled extremely well. I was pretty much back to functioning fully 3 days later with mild to moderate pain. So without any of, the unfortunate side effects of like the breathing issues. So that was kind of my experience from it.
We actually had to do allergy testing and test doses and all sorts of things to see what was going on. We never actually figured out what it was, although with a lot of pre-meds and subsequent doses, she seems to tolerate better. But she still tells me she gets enough relief that it's worth it. Even when she felt terrible for a week, she would feel fantastic for months.
Mm-hmm.
So, and she was doing quite well on that combination until November 2020, when Taylor got COVID. And one of the things we'd already talked about in theory was, what would we do about sirolimus when that happened, and what might happen to her disease? And a lot of people, I think, going into COVID were worried about our patients on sirolimus, that they might have a worse case. The thing that I was most afraid of was that someone like Taylor, whose disease is very sensitive to changes in dose and things, that she might lose control, that we might have her disease get out of control after it's been fairly well controlled for so many years. And that's actually what happened. It was terrible, terrible to watch. And I wasn't even directly there.
So what as this was going on, and what was your thought process, and what other therapies were you considering?
We had been talking for a long time about other possibilities, the newer agents that are available now, the AKT inhibitor, morancertib, potentially the PIK3CA inhibitor, Alpelisib. And we were trying to get that information. So she did have some prior tissue long ago when her diagnosis was first made, but it was all bone. And so we weren't very optimistic, but we did send it for testing. We were actually in the process before she got COVID. Unfortunately, it came back negative with no identifiable mutation, even at my favorite lab, who works really hard to get those results for us. So we didn't have that diagnosis, but with her so sick and basically taking her sirolimus and having the same levels, but just having every symptom back, like she wasn't even on it, we decided to make the leap and go ahead and try it. And we were able to get that approved through the managed access program, despite not having the identified mutation, given that there is good information out of Mike Dellinger's lab that we think PIK3CA is responsible for most cases of GLA. We were able to justify that. And so we were able to get that for her and get her started on that. And you can talk about how that went.
Yeah, and I would kind of like to talk a little bit about kind of like my decision making with that too, because I think with the transition of care, being a young adult now and making these decisions on my own, it's the first time my mom, even for instance, who's my best friend through a lot of things, was just like, this is for you to make, like, it's time for, you have to decide this on your own now. And I think just from my perspective too, and something I hope patients and parents take away from this is when there's new treatments, yes, they're scary. Yes, they have side effects, and we don't know what they're going to be like long term. I can't say, today what this is doing to my body long term, but my quality of life 6 months ago was absolutely horrific. Lowest point mentally and physically for me. I talked to Dr. Hammill about this, and as a therapist, I have no problem sharing this as well. I think it's good for people to know. Is the first time I started on antidepressants as well. I was having severe panic attacks due to the way my disease just completely shifted. And it's so unlike me because everything at that point, being very physically active, that's like my biggest coping skill. And at this point, it was taken away. So being not functional, and I was barely even working, all of these things combined, I was ready to hop onto this treatment. I was ready to try anything, and to really put your trust in your providers that are in this field, because we've spent so many years trying to figure out our diagnosis, that when there's people that are educated on this and supporting you, you really just need to jump in. And that's kind of how I felt.
Thank you, Taylor. I think that's really an important point. And obviously we focus a lot, both as physicians and care providers, on the physical part or the physical symptoms that individuals have. But mental health is a huge component, particularly of chronic diseases that fluctuate in their severity. And so I appreciate you bringing that to the forefront, because I don't think that gets talked enough with regard to how we take care of patients. It's not just mediating the physical symptoms, but really addressing the mental health needs as well. So thank you. Dr. Hammill, do you have anything else to add?
I mean, I would say that, we talked a lot about the potential side effects and what we needed to watch for. But when she came back after 1 month, she looked at me and said, "This has been so great. It's the first time I don't feel like a sick person." And I was shocked and so happy, because that's better than I hoped, that it would make a difference that quickly.
That is fantastic. And as you know, Dr. Hammill, that is the experience with many patients with Alpelisib, is that it's not months and months of taking it to get an effect. It's something that can occur in weeks, not in everybody, but certainly in many. So I think that's a really important point. So,
and that made me feel better that we were on the right track, since we didn't have genetic proof going in. And not to say that you didn't have any side effects. We tweaked the dose around a little bit over the next month or two, and she did get a few side effects, but they were less than with sirolimus, and no more Bactrim, which she hated.
Yeah. Yeah, and I think that's something really important to talk about too, because I think side effects is a big reason why patients aren't wanting to get on board with treatments. And just from what I can say about the Alpelisib is, I have had like a moderate rash on my face that has been coming and going. I take Benadryl at night daily, and that's really kept it under control, along with typical muscle aches and fatigue have been noticeable. I've had some hair thinning, but for the most part, these things have been manageable, with medications and what we can do to keep it on track, versus on the sirolimus, I felt like I was constantly like, it's nausea today, it's pain today, it's a mix. My face is breaking out and I have a mouth sore, and like all of these things combined. And I feel like now it's like, it's under control and my underlying disease is under control. And that's what's far more important to me than the other things. Yeah.
Fantastic. And now I would like to introduce Dr. Kim Steele. Again, she's our Director of Patient-Led Research at LGDA, and she has some questions for Dr. Hammill and also for Taylor. Kim?
Hi, and I first want to just say how brilliant this has been so far. From my perspective, as the Director of Patient-Led Research, from both of you. From the patient's perspective, the fact, as myself, as a mom of a child with the disease, Taylor, I think I've shared this with you before. It's so inspiring and motivating to know that there are patients out there that are doing this and are looking well and are trying new things and being a part of the research to help the community as a whole. So it's incredible and very helpful. I know that when parents watch this, they're going to take a lot from it, including the most important part about letting your child be a part of the decision too. So that was fabulous. And Dr. Hammill, I have wanted to meet you so much, and I'm gaining the opportunity. And again, I think what's important from the patient's perspective is to hear the doctors and how much passion and how much you all care, because sometimes that message is lost. And so what I found so incredible about this job right now is being the bridge and showing the patients how much the doctors are thinking about them 24/7 and wanting to do great things. And also coming back to the doctors with the incredible information that the patients are bringing. And so I had to say that. I know I'm taking time, but now Taylor, can you tell me, as a mom of a child with KLA, you know, one of the things that's scary for me is the transition in care. And as he grows up, because he's certainly a tween now, what are some tips and pearls that you can share, you know, just about that transition and what's been helpful and what hasn't been helpful?
What I feel like the most important thing about living with a rare disease is understanding that it's a marathon and not a sprint. Things that we want aren't going to come overnight. Everything starts with research. And I think it really comes down to, in order to be able for us to transition to care better in generations behind me, is that we make sure research happens. And that's going to start with parents being more on board with educating their kids as well about what that means. I'll be the first one to admit that I was an angsty teen that when my mom had a form that said lab test for research, right? And I'm thinking like, more blood, like what's that going to do for me, right? Like how is that going to impact me? Explaining that to your kids in a way where they see the long-term picture is going to be so incredibly important. Education is everything in this, and advocating for our future transition of care, because that's been a challenge for me, right? I just turned 27, and you know, thank goodness that there's an adult center at Cincinnati Children's, but I know that, you know, there's going to come a time when I hope that, you know, our community reaches, you know, more physicians that can help my disease. But just from, you know, for parents, just, you know, pay attention to how we can let the kids kind of educate themselves and move forward.
You know, so I'd like to really go forward with that, because I think the message is so important, right? And you see me active on Facebook. Come on, guys, get into the community, right? Could you tell our community, you know, you've said about the importance of allowing your child to see and be part of the decision making. Can you explain why you think it's important to have an active role like you have had, and it's made such a difference for me and many others? So why is it important? What is the why of why we should take an active role in our care and research as a rare disease patient?
Yeah, for me primarily, and I don't think that I would be honestly sitting here today if I hadn't gone to therapy to work through this. I really had to get to a point where I've accepted my disease in my life, and making sure that you're truly accepting what you're getting into. So being part of a community like this one, you know, you feel alone at first. Before I connected myself to our support groups online and just to other individuals living with this rare disease, I can't tell you how alone you feel. I didn't know anybody like around me, obviously, that has this. There's not many of us. So just getting involved and getting those connections, I feel like, is really what sparks getting people excited and passionate about research. So I promote my groups. I suppose I could put these in here too. I run a 18 to 26-year-old young adult group on the link is on Facebook, and our purpose is kind of like getting our young adults through college and jobs and relationships and being able to transition through that time. We also have another peer on there. She's going to begin the group with 27 to 39-year-olds. And I think just the most important piece of this is just throw yourself in and get support where you can, because that truly has made such a difference in my life and how I view my healthcare.
And I just have to comment that I've had the privilege of sitting in on your sessions, and it's spectacular. And what you are bringing to our community and what the patients are bringing back to the clinicians and scientists, wow. And so that's where I turn to Dr. Hammill and ask, as a clinician scientist, can you tell our community what you think is the importance of their voice and the importance of participating? Even myself, I was so leery with Michael and what we were going to do and what we weren't going to do and who do we trust. And in the end, I understood that entering him in the registries and the natural history studies and whatever we could, as long as he was safe, was important. So maybe, can you comment on that a little bit?
Sure. I think it's for us to be able to hear what everyone's going through as a parent or as a patient is really important. There's a lot more emphasis now on the patient-reported outcomes and figuring out what part is important to the patient. It's not always the lab work. It might be how you feel. So even if the labs didn't change on Taylor that first month, boy, did she feel different. And that was the big win. And so I think having the physicians encourage the patients to really give us that feedback, what's important, how are we doing on that, what do we need to prioritize, and what's not good enough. So I could fix your labs, but if you feel terrible, is this the right thing? And so what I've tried to do with all of my patients, and Taylor is one of the most vocal and interactive, so that's really helpful, is really say, why are we doing it with any treatment? What is the point? What is our goal? Is it pain? Is it labs? Is it risk of bleeding? And knowing what are the goals and how are we doing, and reassessing that every time we talk and in between if we need to know if the side effects of whichever treatment we're on are still worth it for the positive effects that we're seeing. And if we're not, it might not be worth it. And of course, we only come onto these new treatments if we have new research coming out of the basic science labs, giving us hints about the right pathways, and having patients who are brave enough and sick enough to need something else. It's not something that everybody should switch to right away. We really need more information before treatments become mainstream. But people who aren't getting enough treatment or getting enough relief or having enough control of their disease, they probably should move on to the next thing and help us figure out how that will work for other people.
That's excellent. So just one more question to Taylor, because I think this is an awesome platform to take back to our clinicians and researchers. So if you could tell the LGDA and the clinicians and the researchers what you need, what we can do more, what do you think that would look like?
I think that's challenging because I feel just such a good relationship, obviously, with Dr. Hammill, and my experience with Dr. Jang. I felt listened to, I felt, supported and all of that. But I think something that would be really helpful just for, others to know that I haven't connected with, if we can just promote mental health more for our patients and make sure that that's a priority. Whether that's even just getting involved with the groups that I've started as a starting point. But I think that for me, in order to progress appropriately with how I've managed my care the last 6 months, therapy and mental health has been a big part of that to where I am today. So, it's hard. I think sometimes you can kind of you can sit all day looking at pros and cons of these medications, but at the end of the day, like, you just need to look at your quality of life, and you need to go with the moment.
This has been a terrific discussion. All of you have done, a terrific job in really framing this in a way that patients and their parents and families can really understand, the opportunities that are out there, but also the challenges that that come with a chronic disease and the fluctuating response, to therapies. So I really appreciate that. And I really would like to take this time to thank all of you, Dr. Hammill from the Children's Hospital of Cincinnati, Dr. Kim Steele, who's the director of our patient-led research at the LGDA, and a special thanks to you, Taylor, for sharing your journey and being, very open about the trials, the tribulations, but also the positive impact that research has had on your life. And I really appreciate that. I'm sure our patient community will greatly appreciate that. So thank you all for participating. And I look forward to the comments that we receive once the video is posted. So thank you.
Thank you.
All right. Good evening.